Let me tell you something the news forgot to mention, something that could affect thousands of people across England and yet has barely been covered anywhere. Starting on the 1st of December 2025, the NHS is quietly introducing a set of changes that will completely reshape how charges, exemptions, and treatments work for certain groups. These updates could protect some of the most vulnerable people in the UK, including medically evacuated families and individuals dealing with serious illnesses like tuberculosis. But here's the catch. If you don't understand these changes clearly, you might end up paying for things that should now be free. Don't go anywhere. What I'm about to tell you in the next few seconds is extremely important, and it could genuinely save people money, stress, and confusion. And if you're watching this right now, let me say this clearly. This channel, Secure Pension UK, exists for you. My entire goal is to break down complicated updates, whether NHS changes, pension rules, or money-saving alerts, in simple, clear English, so you never miss something that affects your life. I've got more videos on this entire topic coming soon, and if you want to stay informed, just hit that subscribe button. Not for me, but for yourself, because every upload is designed to protect you and help you stay ahead. Now let's get into the December 1st, 2025 NHS changes and what people absolutely need to know. From the 1st of December 2025, the NHS in England is updating how certain charges and exemptions work. And although the changes might sound technical on paper, they carry very real consequences for everyday people. One of the biggest shifts relates to individuals who were medically evacuated from war zones or active conflict areas. For the first time, this group is being clearly recognized in law as eligible for full remission of certain NHS charges and for help with essential travel costs linked to medical treatment. This matters more than people may realize. Imagine someone being flown out of a conflict zone, injured, traumatized, or suffering from a serious health condition that couldn't be treated where they were. For years, many of these individuals have faced uncertainty over whether they needed to pay for prescriptions, glasses, travel to appointments, or other essential care. Some were charged incorrectly. Some avoided going to the GP or hospital altogether because they feared bills they couldn't pay. Now, from December 2025, the rules make it absolutely clear. If you or a family member were medically evacuated into the UK, you may no longer be expected to pay certain fees for prescriptions, treatments, or travel, depending on your individual situation. It doesn't stop there. The updated law also widens access to free NHS site tests and optical vouchers for people who were medically evacuated. What does that mean in practical terms? Well, if you were evacuated due to war or conflict and now find yourself struggling with your eyesight or needing glasses, you might now qualify for free help. No more out-of-pocket costs for essential sight tests or lenses, but only if you understand the rules and know to ask. Another major change involves prescription charges for tuberculosis medication. Certain drugs used to treat active TB are now exempt from prescription fees when supplied under the correct conditions. This is not only a financial change, it's also a public health strategy. TB treatment must be completed fully and consistently. Any interruption increases risks to both the patient and the wider community. By removing the cost barrier, the NHS is trying to ensure no one skips medication because they can't afford it. If you or someone you care for is undergoing TB treatment, check with your GP or pharmacy to confirm whether your prescriptions now fall under the new exemption. You should not be paying if the treatment qualifies. There's also an update to something many people overlook: prescription prepayment certificates, or PPCS. These certificates are often purchased by people who need several medications each month, allowing them to pay a fixed price instead of individual charges. The December 2025 update includes slight adjustments to how refunds are calculated when someone decides to cancel their PPC early. The refund amounts for the 3-month and 12-month PPCs are being updated. So if you cancel a certificate mid-term, maybe because your treatment has ended or your eligibility has changed, the amount you're refunded will now be slightly different. If this applies to you, double-check the updated refund tables on the NHS website or speak to your pharmacy so you know exactly what to expect. Now, let me be absolutely clear. These changes are not a blanket removal of NHS charges across the whole of England. Prescription charges still exist for most people unless they fall into a qualifying exemption category. Dental charges still exist. Overseas visitor charges still exist in certain situations. The December 2025 updates are targeted, extremely targeted, and are mainly designed to protect medically evacuated individuals and support public health around TB treatment. So please don't assume that everything is now free. Always check the specific service or medication you need. So let's talk practically. What should you do if you believe these changes apply to you or someone you help? First, check your eligibility. If you or a family member were medically evacuated from a conflict zone into the UK, contact your GP practice, your local hospital, or your local integrated care board's advice line. Tell them your status clearly. Bring any documents you were given when you arrived in the UK, arrival letters, evacuation papers, reception center documents, because NHS staff will need to verify your situation before applying the exemption. If you're receiving treatment for active tuberculosis, make sure your prescriber marks the prescription correctly or uses the proper patient group direction. This ensures that when you go to the pharmacy, the staff know the prescription is exempt and should not charge you. If the pharmacist still attempts to charge you, stay calm but firm. Politely reference the updated rules and ask to speak to a pharmacy manager if needed. And if it still isn't resolved, you can contact NHS England for clarification. If you use a prescription prepayment certificate and want to cancel it, ask the pharmacy or the NHS Business Services Authority for the updated refund calculations, so you're not relying on old numbers. If you are a carer, a community advisor, or someone who supports vulnerable individuals, keep records, proper records. Save email confirmations, write down names, keep hold of reference numbers from calls. Print or save the guidance documents. Because if there's a dispute later about eligibility or a refund, having a clear trail will make things much easier. Now let's discuss who is not affected by these changes so there's no confusion. First, these updates apply mainly to England. Scotland, Wales, and Northern Ireland manage their own exemption systems and prescription rules, and these changes do not automatically apply across the UK. Also, these new rules do not remove all NHS charges. Dental charges remain as they are. Many non-prescription fees remain. Overseas visitor charging rules remain in place, except for the newly clarified evacuee category, and exemptions for people on low incomes remain tied to existing schemes such as NHS low-income certificates or qualifying benefits. There's a broader purpose behind these reforms too. They're not random tweaks. They are designed to remove financial barriers for people who urgently need care and to improve public health outcomes. When vulnerable people avoid treatment because of cost worries, the risk spreads to everyone, especially with diseases like tuberculosis. The TB exemption is a strategic preventative health measure. It aims to reduce risks, reduce costs long-term, and ensure that treatment is completed properly. A quick note on timing. The rules take effect from the 1st of December 2025. So the dates matter. If your treatment or arrival happened before that date, the previous rules might still apply. If it happened after, the new rules should be in place. Keep any documents that show dates, arrival letters, referral notes, prescription records, and ask your NHS team to confirm clearly which rules apply. If you want to be proactive, reach out to your GP practice or your local hospital's Patient Advice and Liaison Service, PALS. Ask them directly how your case will be handled under the updated regulations. And if you receive a bill that you believe is incorrect, do not ignore it. Contact the billing team immediately. Ask for an itemized breakdown. Challenge the charge, explain why you believe it's wrong, and keep copies of all correspondence until the matter is resolved. For journalists, community leaders, or volunteers helping new arrivals, it may also be worthwhile to share plain English summaries of these changes in multiple languages. In the past, confusion over NHS charges has discouraged people from seeking care early, which can be dangerous. Clear communication saves lives. I also want to highlight a potential issue many people overlook. Frontline NHS staff may not be fully briefed on the new rules straight away. Changes like these take time to filter through GP surgeries, pharmacies, hospitals, and administrative teams. So if you're told you're not eligible for something that you believe you are entitled to, politely ask staff to double-check the updated guidance. Escalate the issue if needed. Most staff want to do the right thing. They just might not have seen the details yet. Another practical tip for those entitled to travel reimbursements: keep every single receipt. Train tickets, bus tickets, taxi receipts, Every bit of proof helps. The NHS reimbursement process requires documentation, and having a complete paper trail speeds things up significantly. Now, for older people and pensioners watching this, especially those on low incomes, I want to be honest. These particular 2025 changes are aimed at very specific groups. They are not general cost of living relief measures. If you're struggling with NHS-related expenses, there may be other support schemes available, such as the low-income scheme, free prescriptions based on age or specific conditions, or local council support. Speak to your GP practice or citizens' advice to see what wider help you might be eligible for. So what happens next? Over the coming months, integrated care boards and NHS England may release additional clarifications or practical guidance, especially around verification processes and staff briefings. As soon as anything new is announced, I'll break it down for you here on Secure Pension UK. For those who want to read the official legal text or the plain English summaries, I'll mention in the description where you can find them. To summarize this massive update, the December 1st, 2025 NHS changes are targeted, sensible, and designed to protect vulnerable groups. They remove financial barriers for medically evacuated individuals, make TB treatment free in specific situations to protect public health, and adjust some administrative refund calculations. But they do not remove all NHS charges, and they do not extend to all parts of the UK. If you think the rules apply to you, check your eligibility, keep your paperwork safe, and ask your GP or pharmacist for clarification. And if you receive a bill that looks wrong, challenge it straight away. If you need help understanding any part of this or want to know how to contact the relevant NHS teams, just ask in the comments. I'm here to help you navigate it. And before you go, remember this. The news might skip the details, but here on Secure Pension UK, I never will. I'll break it down, simplify it, and make sure you understand exactly what's changing and how it affects you. If you got value from this video, make sure you subscribe, turn on notifications, and stay connected, because every update I give is designed to protect your health, your finances, and your peace of mind. Thank you for watching, and I'll see you in the next video.